Recently in Polk County, it was decided and found that many residents who are of a lower income bracket are having a lot of trouble getting dental care that they so desperately need. And as we all know, so much of a person's success starts with their mouth. So with us today to talk a little bit about a new initiative that Polk County's Indigent HealthCare Division is doing to help with this problem is Joy Johnson, the director of the Indigent HealthCare Division. Joy,
Hi.
thank you for joining us today.
Thank you for having me.
What is it that the Indigent HealthCare Division is actually doing as far as this dental initiative of yours?
Well, we are looking at ways to partner with our community agencies to expand access to dental care for the un- and underinsured in Polk County. And that's people who don't have private insurance coverage. They may or may not have Medicaid, or they don't have full benefits under Medicaid or another program, so they still lack those services.
Okay, so what exactly spurred the Indigent Healthcare Division to want to increase the opportunity for dental care to these low-income residents in Polk County?
Well, each year the Robert Wood Johnson Foundation releases a report on a county's health rankings. And for Polk County, last year whenever they released this number, the number was really staggering for the ratio of the number of dentists for people in the county. So for Polk, there is one dentist for every 4,000 people, approximately. And that, to me, was a pretty staggering number, and it's really worse off than the state or the federal government. And so we saw an opportunity to do something about that by embracing our community partners.
Well, that's really kind of amazing to think about, and I'm sure for low-income people it's even more difficult considering as few dentists there are out there available to people with dental insurance and things like that, but people who have no access, that's got to be really difficult to get the proper care that they need.
Right, and they often don't know who provides care, what type of care, are they even eligible, do they qualify to obtain or receive this care, and can they even afford it? So it is difficult for people who don't know where the services are and don't have that access.
Now, how exactly is the Indigent Healthcare Division helping meet this challenge head on? Is it something that you're giving people the dental services? How does this work?
Well, it really all started back a couple of years ago. Polk County has had a history of working with community partners to provide different types of healthcare services. And in the past, and even today, we still continue to partner with Lakeland Volunteers in Medicine and Travis Career Center because they have a dental assisting program. And so we've taken that opportunity to work with them and engage them so that the people who don't have any other way of getting dental services, those would be two access sites that they would be able to get that, but we know that that's not enough. So about 2 years ago, Polk County was awarded a low-income pool primary care grant, and that is a grant with Lakeland Regional Family Health Center, Peace River Center, and the Florida Department of Health in Polk County. And Polk County Indigent Healthcare is a partner in that grant. So one of the things that we outlined was that once we geared up to provide primary care services at a site to where people can also get behavioral health services in a co-located setting, we knew that we wanted to address dental, but we needed to get up and going and get this program running first. So now this past year, we really started to gear up and focus on putting some additional funding and prioritizing dental as a service to really expand on for the community. And so it was that grant that really spearheaded this, in addition to the fact of the county health rankings. So we just use this grant as an opportunity to really expand that and engage our community partners to help us do that.
So really, in a lot of ways, this is a grassroots partnership with people with different organizations out in the community that have specialty in dental care and things of that nature that can help provide it, and you just help funnel people to the correct place that they need to go to get the care.
That's right, and in fact, the county, we put up a $1.7 million of matching funds in that each year, approximately, for $4 million to come back to the county. So with that funding, people are able to get primary care, behavioral health, but now they can also obtain dental services. And we do that by having several different locations for them to be referred to. In the Florida Department of Health, they have 4 dental locations in the county. So if a participant in this program gets primary care access, or they go and see a behavioral health specialist at that location, they may need dental care. So they will be referred to an access site, either of those 4, And Peace River Center also provides access on site because the dentist from the health department will periodically visit that site, provide those evaluations in a setting that's comfortable for those members. So we really see it as a win-win for the stakeholders, for the community, for our partners, and we're really glad to be expanding this in the community.
Now, I know, having lived in other counties, I don't think I've ever seen a partnership to this extent that has this many partners involved that's really come together to help the community in this way. That's great.
And that's one of the things. It's hard to get different agencies who have different focuses and objectives that they've got to carry out. But to bring everyone together, to me, that is a success for this community. And it really shows the fact that everyone has come together and they are dedicated to make sure that we can expand these services and get these people the care that they need. Extending from 2 locations that Polk County Indigent HealthCare would generally have to refer people to 7 or 8 locations now. That's really a lot of work in a short amount of time, and we're still not finished yet. We've got a lot more that we want to do, so we're excited about it.
Well, what are some of the plans that you have in the future then that excite you, that might be coming around the pike soon?
Well, we do want to continue to expand access to dental services in the community, and there are 2 locations in Polk County that we're focusing on. One is Mulberry and one is Winter Haven. And we are really in the middle of those planning efforts to see what we can do, and there should be more information coming out about that here in the near future. In addition to that, one of the other benefits that's come as a result of this initiative is that the partners now all come together on a quarterly basis. We get in a room, we talk about what's going on in the community, how is changes in health reform and all these other changes that are going on in regards to dental or healthcare affecting each agency and their ability to provide services to people for dental. And so it gives us the opportunity to talk amongst ourselves, to learn what the other is doing, who can we refer to whom, when, and where. So we're all able to start getting on the same page now and work jointly in a partnership. And one of the things that we want to do is, bring a day here in Polk County to where our dentists, our community stakeholders come together and we can focus on providing one day of free dental care to people in Polk County, similar to what they do in Tampa for the Mission of Mercy event. So we're just now starting to talk about that, what we would need to do to make something like that happen, and we're really excited about it because we think that we've got a lot of good ideas and that we've got people who are dedicated to making something like that happen and give back to the community. So
well, that really is exciting. In a lot of ways it seems that rather than having this big umbrella federal sort of thing that forces solutions on people, it's really a local initiative looking at the problem and the challenges from a local level so that the best possible solutions can be found.
That is right, and the fact that the community has taken it upon themselves to come up with some solutions and come to the table and work it out. It's really great for everyone.
Now, what are the criteria necessary that people who want to participate in this initiative, if let's say I'm a low-income resident and I am starting to have some problems with my teeth, how do I take advantage of this program?
Well, there are several doors and access opportunities to access the service. However, we at the Polk County Indigent HealthCare Division, we have a hand in a lot of those opportunities with a lot of those agencies. So if someone simply calls 534-5387, we've got customer service representatives on standby to help direct these people to the appropriate place to receive care based on their where they live and what kind of service they may need. So a person would also have to be a Polk County resident, and they would have to be less than 200% of the federal poverty level. So those are the criteria really that we go on to determine eligibility for this program for people to get those services.
Excellent. What are some of the services that people can actually get?
Some of it is preventive care, palliative care. They can get basic evaluations, cleanings, extractions, just to name a few. There are some things that we're looking at expanding in the future. It may not be all above and everything under those types of services, but we are actually looking at expanding that as much as we can in the future. But those are just a few of the services that they can get.
Now, tell us again, who are the partners that are that you have formed together for this initiative?
Well, we've got a free clinic, which is called Lakeland Volunteers in Medicine. They're a nonprofit, and they provide free primary care to eligible residents of the county. They also have a dental suite located on site. And one of the things that's great is that the Florida Department of Health in Polk County, they actually put a dentist on site at that location, in addition to other volunteer dentists that provide that care, to expand the access. So the second partner would be the Florida Department of Health in Polk County, our county health departments. In addition to that, we have Travis Career Center, which is operated by the Polk County School Board. And again, that's the dental assisting program. In addition to that, we have a federally qualified health center, and it is Central Florida HealthCare, and they've got a number of locations throughout the county as well. So the Central Florida HealthCare and the Florida Department of Health have multiple sites where people can go to receive dental services.
That's really exciting with the way that you have this partnership set up, is the fact that it seems like wherever you live in Polk County, there is someone not too far away that you can theoretically go to if you need these services.
That's right, and we're looking at expanding to 2 additional locations here in the near future, so it's really exciting. We want to make sure that there's something close by for everybody, because Polk County is so big and so rural, so we're excited about that.
That really is great. Joy, thank you so much for coming out today and telling us all about this.
Thank you for having me. I appreciate it.
Now, if you are a Polk County resident who meets the criteria set down for participation in this initiative, go to the website for the Polk County Indigent Healthcare Division at polk-county.net, or you can call them on the telephone at 534-5387.